I'm currently a PhD student at the University of Southampton, and I'm looking at maternal and child nutrition in sub-Saharan Africa. But I'm also doing another qualification to become a chartered health psychologist. So I kind of do that on the side, kind of part-time. And then I'm also do my PhD part-time. So in my full-time, I'm a full-time research assistant on this global health project. I'm part of a big research team, and we're looking at ways to improve people's diets and what they're eating and how they're getting their food, and particularly for mothers and their children. And that's in some quite small communities, quite rural communities in Ghana and Burkina Faso. So that's in the west of Africa, and then also in a urban kind of township in South Africa. So that's called Soweto. It's quite a famous place. And my PhD especially is thinking about ways to really engage with the community members and getting them to think of the solutions for themselves. So it's not great for researchers just to come in and say, you need to do this, you need to do that. It's more about the local solutions and what they can do for themselves. It was interesting because some of the nurses in Ghana were telling them to eat bananas and apples. That's one of their 5 a day, but they're like, we don't have bananas and apples growing in our communities. So it's either really expensive to buy that or we can't. So I guess at that level, you're being told to do something and you can't, so you kind of feel like a failure already because you just can't. So we have techniques of how to engage with communities. That's basically what I'm really interested in. And through those solutions, we think of the exact behaviours that they could change to improve what they're eating. And a lot of it isn't about they are just choosing not to eat well, it's just because they don't have that food in their communities, and it's thinking of ways of things that they could do, such as make vegetable gardens together so they can grow their own crops and eat those foods and also sell those foods. So I don't really know what is going to happen in the future. I want to continue working with people, including them in all their decisions and involving them and making sure that the solutions come from them and not from us. I just don't know how exactly that's going to happen, but hopefully it will. I work within the Faculty of Medicine, and obviously I'm a psychologist, so there's lots of doctors, there's lots of nurses, there's lots of other psychologists, there's lots of sociologists, lots of people working in public health. So it's really nice to kind of lean on different people and their perspectives, and we all work really well as a team because you can't really do medical research without a broad range of people working with you. Before the pandemic, we were travelling a lot. I was travelling a lot to South Africa and to Ghana. Wasn't allowed to go to Burkina Faso because there's some civil unrest there. But it was really great to just go and meet the team. And I think compared to some English colleagues I have, just the teams in Africa are just a lot louder and just more expressive and just really, really friendly group. And it's just really nice to go and visit their countries and really get to know them. A scientist can be many, many different people. Obviously, I'm coming from a psychology background, and that does still count as a scientist. So, and like I said, all of my colleagues are, medical doctors, or some of them are nurses. We have research nurses, or sociologists, or they're just coming from lots. And actually, we're starting to work with a lot more kind of artists and graphic designers, and that's really a big part of communicating our science. So I think, all these different people working together are scientists. The University of Southampton have been really good at kind of giving me opportunities to work in different places and work with different teams and to work on different projects. And it has lots of different collaborations. So they work with a lot of the professors here are kind of world renowned. They have written lots of big papers in the Lancet and in Nature journals. They have lots of collaborations around the world. And they give you every opportunity. Well, my supervisors anyway, and the people around me have given me as many opportunities as they can possibly. That's probably the key to my success, is having really, really supportive people around me. And those people, for some reason, are at the University of Southampton. It makes it very hard to leave when you've got such supportive people around you. Get lots of work experience, talk to lots of people if you can, volunteer in what you're interested in. I think a big tip is to try things. and work out what you like and what you don't like about it. And throughout my degree as well, I know obviously you would be quite young, but I just kept volunteering and kept trying things out just to see what I liked and what I didn't like. And there's loads of things I didn't like, and I will never do that again, and that's fine because now I know, and I'm definitely not going to pursue a career in that. But yeah.